So I attended the health supply chain course run by PSA, and I was very pleased to attend it. It gave me a better insight into how I can actually take away some of the health supply chain practicality measures and methodology that I learned from that to apply to my projects in Sierra Leone. I think the biggest thing that I learned was about really the operations, so everything from how to pick the right supplier, how to deal with expired stock, how to deal with human resources issues, distribution, warehousing. So a lot of the areas that we covered was very relevant to somebody within health supply chain in an international development capacity as I am. And I was very pleased to attend it. I enjoyed the course, I enjoyed Oxford. I think that I will go away and be able to apply a lot of the methodology I learnt, particularly with regards to the housing and the expired stock and the methodology to my project in Sierra Leone.
It was bringing in the technical aspect. I'm a pharmacist by profession, and bringing in supply chain component for health commodities. The challenge that I face working in a developing country is you end up doing more of supply chain and less of the technical aspects of my pharmacy training. So this course has provided me a forum to bring the two and understand how some of the frameworks, for example, the ones that are provided for by WHO on access for medicines, how you can bring that into supply chain management. So it was a good tool for bringing these two components together.
The knowledge that I gained from this course has enabled me to understand the end-to-end issues about supply chain. Supply chain is not only about procurement or about warehouse, it's the whole understanding from the selection, procurement, budgeting, warehouse, distributions, right to the user level. And the knowledge that I have gained and the skills that they have equipped me in this training course has enabled me to be knowledgeable about the whole program. Before this, I only know about supply chain on a very piecemeal basis, on a certain functional. With this knowledge, I can take it back home and advocate and also share this knowledge with my leaders and also with my colleagues at home to understand supply chain is not only about certain issues, but we need to look at it from an end-to-end package or end-to-end solution in resolving issues that are much a problem to the developing countries, which is shortages, which is out of stocks, which is expiry, which leads to wastage. And something that I learned in the public health supply chain is, that really grasped my attention, is that out of stock and shortages is not a problem. We need to look at the system and all relevant issues that contributes to stock out and out of stock, because the system is a problem. It's not out of stock, it's not shortages. So those are the knowledge that I've gained in that first week of the training, and I'm ready. I'm so eager to go back home and to share this and to strengthen all the functional programs or activities within the supply chain cycle.